Dealing with hip arthritis can be very annoying and frustrating at times.
That's right, and we have put together 11 key insights and exercises to help you get through this and possibly avoid a surgery. I'm Brad.
I'm Mike, and behind the scenes we have Bob, and together we are the most famous physical therapy team on the internet.
In our opinion, of course, Mike.
Now, we have treated thousands of people with hip arthritis when you combine all our years of experience between Bob, Brad, and myself. So we got 11 things to go through. This is only 6. I don't know what I'm doing with my hands. And we're going to go from least important to most important.
There you go. Now, Bob actually did the math on this to figure out exactly how many years of experience, but we're not going to get into that. Let's start with number 1. This is important. I've had great success with this with a lot of patients.
You're going to want to sleep with a pillow between your knees if you currently are not. Obviously, that doesn't affect you if you're on your back or your stomach, but if you are a side sleeper, having your hip, especially painful one as you sleep, might rotate and go like this. This can put more pressure on the hip itself. So if you're arthritic, it's not going to feel good. Simply put a pillow the long way in between here. It's typically more comfortable, and just sleep like this. You can see now my hips are more aligned and they're not in a downward angle like this.
Yeah, now actually, if you are a back sleeper, I have had success with patients that say, well, try putting a couple pillows under your legs like this, and that can relieve pressure off the hip as well. It certainly helps the back for a lot of that people. So it can be a double benefit thing. Let's go to number 2.
Number 2 is moving your hips more frequently. Typically arthritis, the more you sit, the stiffer you get over time. It's important to work on moving your hips in and out. Most people, when standing up and walking, you're going forward and backwards with your hip joint, but you're not moving in and out too often. So whether you're in a standing or seated position, just getting some motion laterally can be beneficial.
Yeah, so out to the side like we're doing here. Keep your toes pointed straight ahead when you're standing. It's one of those little things that can make a big difference, strengthening that hip muscle that we need strong. So number 3, this is an interesting one.
Drink more water, because your cartilage within your body is made up of 60% water, and they recommend drinking 100 ounces a day. What is that in liters? I don't even know.
That's a lot of water. I just figure about 8 glasses. Actually, it's true. Most seniors, and particularly, are dehydrated. Not getting enough water is pretty typical.
So it might help with your arthritis pain. You can let us know if it does. Or maybe Brad can. He's getting close.
Let's go to number 4. Thigh stretch. Yeah, get that age thing out of it. I am getting there, though.
Number 4 is making sure and stretching your thighs. Now, most people tend to get tight hip flexors, muscles in the front of your hip from sitting so often. So in order to stretch it, we're going to do a laying down option because most people feel comfortable with this. Many of the other options are kneeling, and if you have hip arthritis, that probably does not feel good. So you're going to need to sit on the edge of a firm mattress. Hopefully your mattress is firm. If you're able to get on a kitchen table or countertop, you can certainly try that. So you're going to lay on your back, bring both knees up to your chest like this. If my left side is my painful arthritic hip, I'm just going to drop it down off the edge. Then I'm going to try to bend my knee to get a different hip muscle. Bring the opposite knee to your chest, and you can see here I'm a little tight. I pull up. I'm just going to hold this comfortably for 30 seconds or so, and then switch sides.
There you go. Just relax. Let gravity do the work. It's a nice stretch once you feel comfortable with it.
If you're really tight, you will notice because your hip will probably be way up here, but make sure to test out both sides because you may notice one side is a lot tighter than the other. Do 2 to 3 sets of 30-second holds on that side. Just give it a little extra. You're pushing me there.
Well, yeah, your right side is a little tighter than your left as far as I can see.
Well, this hip feels good at least, but
okay, well, still.
It's good to know.
Yep, it's no big deal.
Anyway, what's the next one?
All right, let's go to, this is related to the hip abduction one where you're doing this exercise or in a seated, but we're actually going to walk sideways. But when you do this, you need to be careful. A really nice way to do it is if you have a cupboard that's 4 or 5 feet long, put your hands on the cupboard and simply walk sideways. You can do it with your hands on the wall, and that lateral motion that Mike was talking about before is real nice to get those hips, muscles, and the joints moving in that direction, which is oftentimes neglected because it's not a natural thing to do.
You know, I think I'm going to put my hands on the countertop because the cupboard's up here, and that might be a little awkward.
Right. Well, sometimes just a wall. Always making things difficult.
I like to do that. The next one is actually when you're walking, if you're experiencing some hip pain, is to try reaching the painful side up like this and take some steps and see if it relieves some pain. Now, this helps most frequently with back pain, but sometimes the hip can be affected as well. If your muscles here are tight and it's pulling up, sometimes it can get those to stretch out and relax. So as you're walking, if you're noticing I'm having more pain, try reaching that arm up for 10 steps or so. Then you can try putting it on your head like Brad was doing while you're walking, and then finally relax at your side. Make sure your side stays in a lengthened position and doesn't get bent over like this again.
Yeah, it's one of those things, as soon as you do it and start walking, if it's the right thing to do, you're going to feel a decrease in pain. So you'll definitely know that. What's the next? Oh, the one that some people are not apt to do is actually get a cane out. If your left hip is a sore hip and you find yourself, oh, it hurts every time you put weight through it, get a cane out. Put it in the opposite hand, which is a little new for some people, but all therapists will tell you that's right. And just a little bit of unloading through the cane while you're putting weight through here can do a tremendous amount on decreasing the weight bearing on that joint, which makes the pain go way down, and it'll allow that hip to feel better, quicker, and make you feel much better. And then you can put the cane away when the flare-up is settled down.
Plus, if people are in your way when you're walking, you can hit them with the cane.
No,
now.
Mike.
You got a
What's
device.
gotten into you today?
I don't know. The next one is to actually massage the muscles around your hip. Now, you could certainly use your hands and dig in there. The hip muscles are very dense and thick and deep, so your hands are going to get tired. So we actually have a newer device that is just coming out that you can check out. Or if you have any other massage gun, foam roller, anything like that, and you feel comfortable, you can use those as well.
Right, yeah. So when your hands and fingers start getting tired, you could, if you got a massage device, and show them one of the smaller ones. This one is a really nice one. It's a newer one. And it's nice because it covers a large area. So you can work that whole thigh here like that. Oh, piece of fuzz. And it has 4 different
nodules, nodes?
No, 4 different speeds. And it's kind of neat because the harder you push, it actually responds and it works harder. It's a real nice device like that. And why don't you talk about that? Because you're not going to get back here on the posterior, the back side of the hip, very conveniently with this.
With a massage gun, you can go into the big muscles, but as you saw with that device, you can hit much more muscle mass at a quicker rate. However, reaching on your side of your hip or even in your buttock, that's not going to be very applicable. So just using a normal massage gun, whatever one you have, just find the trigger points or sore areas, kind of work on it, and kind of do different motions with your hip while you're doing it, because sometimes you won't notice the pain. Stretch a little bit, and then you'll feel it. So just mess around and see if you can relieve any tension that way.
There you go. Now this one I was using, the plate comes off and you get 4 individual heads, and that is a whole nother experience. And then you can get a little more definition on where your massage is. You do whatever works. I personally, when I massage my hip, either with the gun, I haven't used this one a lot because it's a new device, but you can work it like this, and then you can get to that spot. Again, a larger area, 4 heads at once. It's a really nice device.
It's called the TheraPanel by Bob and Brad, if you're curious.
TheraPanel.
TheraPanel.
Nice name. Very, very astute.
Now, the next 3 tips can help your pain the most if you happen to have these issues. So number 9, 10, and 11 here are going to be the most important to try out. The first one is going to help with a issue called Anterior Femoral Glide Syndrome, which is a mouthful to talk about, and Brad is going to grab a hip joint there and explain it a little bit quickly.
Okay, so you have the femoral head here in the socket, so the ball in the socket. Anterior glide means the ball is actually pushed forward and it's not in there and it's not working as well as it should. It creates pain and it can make the arthritis problem get worse faster. So we're going to actually apply some pressure and pull it back in so it settles in where it needs to be. The previous stretches that we did actually is going to help promote and allow this to happen even easier. Mike, go ahead, show them that nice stretch.
So when you're doing this, you can use a belt and just loop it around some sort of sturdy object. Maybe your kitchen table is really heavy, or some stair railings like this. A belt, you're not going to get the stretching component this will get, but it works just the same. So I like the loop band, and I'm going to get some tension in here. If I'm going to stretch my left one here, get it as far up into your groin area as you can comfortably, and then you're just going to kind of lean forward into it. If I have a belt, I'm not going to have that play to lean forward. You're just going to get that pulling feeling. What do you think? I have balance issues? Or
well,
what?
some people may, Mike. I'm just trying to be considerate.
If you have poor balance, a band is going to pull you back, so just be weary of that. The belt won't do that. But just kind of go forward, and if you feel like this is relieving your pain and feels good, it's something that will work for you. If you don't notice a difference with this at all, then you don't have that problem. You can also kind of try going at different angles. I don't need the cane. You can go sideways like this and kind of do a lateral lunge. This one often feels pretty good for me if my hip's bothering me at all, and I just stretch this way. So just kind of mess around with it. You can sit here for 30 seconds. You can do 10 reps, whatever feels comfortable for you. And I'm pulling the stairs away. I'm too strong.
There you go. And then next thing, now this is interesting. These concepts that we're showing now are actually something new to us in the last few years through a therapist named Rick Olderman. He's written books and really has some nice ways to treat. You can self-treat with these. And that is the walking, the tiptoe walking, which is really interesting. Go ahead, Mike explains it better than I.
Oftentimes, if you're having joint pain, whether it's ankle, knee, back, or hip, you are typically probably walking with a heel strike pattern like most people do. So what I want you to do in your house is place your hands on your buttocks, walk around like you normally would, but be barefoot for this or in slippers, something like that. See how much your glutes are engaging. Then we're going to do the opposite and try to walk on your tiptoes if possible, and you're going to feel how much your glutes are engaging now. I'm feeling my glutes engaging way more. That means they're firing properly, and this is going to take pressure off of your joints and engage your muscles more. Now, we're not going to walk around on our tiptoes all day, so what you want to do is just walk with a bent knee like this, and I'm not going to land with a heel strike out in front of me like this. I'm going to land with a shorter distance, a flat foot, or maybe land a little bit on my forefoot and then my heel. It's going to take some time to get used to this, but if you notice a big difference in your pain, it's something you want to progressively work towards.
And I want to make it clear, you don't have to pull your pant leg up to do it.
You show the whole city, everyone around you, that you're walking like this now and you're proud.
Yeah, I think he was just trying to show there's a flexion in the knee, and that allows it more of a spring action, taking a lot of force off that hip.
Yeah, the shock absorption goes into the muscles versus the joints itself now.
Exactly right. And then these glute muscles that fire more when you do the forefoot walking help pull that hip joint back, which allows it to get where it needs to be, which complements the exercise with the strap that Mike was showing before. And now we want to do even more strengthening of that glute. And there's a nice exercise. It's pretty simple. There's two ways to do it: on your hands and knees, and I'll show you a position or a way you can do it standing.
If you're comfortable on your knees, you can do it this way. I feel like most people with hip arthritis probably aren't, but so you're going to go on your forearms and your knees like this. If I'm doing my left hip, I'm going to put it up in the air. Now, I'm not going to do a full glute pump, the common exercise you may know. We're just going to go in the middle and do little oscillation movements. We're going to shoot for 30 reps total. If you need to do 3 sets of 10, 2 sets of 15, whatever works. If you're not feeling much glute activation and a lot of hamstring, try rotating your foot in like this. It's going to isolate the glute max a little bit more. Again, do 30 reps and do it on both sides.
There you go. And if that's not comfortable for you, because getting on your hands and knees can be challenging, particularly with hip arthritis, simply go up a cupboard or a firm piece of furniture. I'm going to work my right side. That's my painful hip. Now, the same thing, I'm going to support myself here, so I've got good balance. Get a 90-degree bend here with this knee, so we're not down here and not up there, right in the middle. And then we're going to go up in this range. So it's not way up like this.
Like a teeter-totter.
Yeah, we don't want the teeter-totter effect. It's here, that mid-range. So not way up into here, but right about there and up. And just oscillate, that 10 to 20 or 30 repetitions. And then you can rotate like this, do the same range of motion approximately, and that'll help isolate those glute muscles. There we go.
Well, those are the 11 tips. The last 3 are the most important. Try those ones out first. Try them all out, see what helps you and what does not, and just keep doing those things each day and see if your hip arthritis can improve.
Right. You'll probably find 3 or 4 of them are going to make a difference, and those are what you'll focus on. And what do we got? Another video that can help as well?
Yes, if you're having hip pain and you want to check out more videos, click the video link on the screen. I said video a lot there.
How to stop hip pain fast. All you need to know.
You'll learn more about this problem.
Mm-hmm.
I'm just going to play with this for a while now.
It is a nice device.
Taking this one home.
Very happy with it. All right, take care.
Bob and Brad, the 2 most famous physical